Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demercy. On today's episode, we're going to have a little dirty talk. We're going to talk about poop. Now, I've done an episode in the past about digestion and beating the belly bloat, but I wanted to have today's conversation to be specifically about kind of constipation and what is healthy poop and bowel movements look like and where do we go wrong from there. Now, your bowel movements tell a lot about your overall health. I ask all my patients, regardless what they're coming in for, about how often they have a bowel movement, and people get so uncomfortable talking about it. But it lets me know a lot about how your body's functioning. Gut health is so important for this gut-brain connection, and it's getting researched more and more. People are starting to understand that there is this big connection between how our digestion works and how the rest of our body is functioning, especially the brain. A lot of people have issues with constipation, and we're going to explore that a little bit more today. So today's objectives are to understand what is healthy transit time, or from food in to food out. What does healthy poop look like? Where does it all go wrong, and why is that a problem? And then I want to talk about a surprising demographic that I've been treating recently with issues with constipation and how that has an effect on the rest of their body and what you can do about it. So let's dive into what is healthy transit time. Now, when I say transit time, that means what the time starts from when you eat a food until when it exits your body. So just because you have a bowel movement every day doesn't mean that you are pushing out what you had earlier or that day before. It could be different. So you need to understand how long it takes from in to out to fully understand the full health of your system. So let's start first with the stomach. Now, what you eat kind of dictates how long it takes for the stomach to empty. Like if you just have fruit, it doesn't take that long for the stomach to empty. It can take anywhere from about an hour to 2 hours. But let's say you had a meal where you had a carb, a protein, and some fat. So kind of like a full meal, like a dinner meal. On average, about the time that it takes for half of your stomach to empty is going to be about 2 to 3 hours with that. Now, the small intestines are a big difference in terms of the range it can be to work through. And the small intestines are 20 feet of loop on average, depending on someone's height, but about 20 feet, we'll say. So it's anywhere from 15 minutes to 6 hours. Yes, it could take 15 minutes for that stuff to work its way through 20 feet of loop, or it could take up to about 6 hours. Now, the biggest range that occurs is actually in the colon, or your large intestine. That is anywhere from 5 to 60 hours. Yes, 60 hours. So if you put that all together between the stomach, the small intestine, and the large intestine, you're looking at a possible range of 6 hours to 72 hours. Yes, 3 days. Now, a doctor says that you'll be fine if you have a bowel movement every 3 days. So that's what's still considered normal. I don't think that's normal. In the efficient state, it should take anywhere between 15 to 18 hours for that food from it entering into your mouth to coming out of your rectum. So that's healthier. And if you really want to learn what your transit time is, the best way to do it is actually to eat a bunch of beets in one sitting and kind of time when the beets come in, because the beets will come out and they will stain your poop kind of this dark color. And that's the way you can kind of tell what your transit time is. And I've had patients who have had like 10 days plus as their transit time. We'll go into it in a little bit later as to why that's not healthy. But that's the best way to find out what your transit time is. It's not with corn. Don't do the corn. It just works through your system. It doesn't digest. But beets is one of the best ways to stain your bowel movement so you can tell what it's like in terms of when you go in from when it comes out. So what does a healthy poop look like? Well, a healthy poop should really be the length of your rectum and then the end of your large intestine called your sigmoid colon. So that's about 12 to 18 inches. Yes, it should be that long. And then it should be almost like the texture of a really ripe banana and have a little bit of that curvature too, because as it's coming through the colon, it's going to have a little bit of a curvature because you should be emptying that rectum and the sigmoid colon. So it shouldn't be too short. It should be all connected. And then it should also be about a medium brown color. So it shouldn't be too dark and it shouldn't be too light. Too dark means that it could be with the food that you ate, but it could also mean that you have an intestinal bleed if it's really, really dark. Like coffee ground dark, I would be concerned about having a gastrointestinal bleed. If it's too light, then it's actually an issue with your bile and not having your gallbladder inject enough bile into your system to dissolve fats. So, fun fact, it's the bile that kind of gives your poop the brown color, because if you don't have bile in your system, your poop could literally be stark white, like eggshell white is what it can be if you don't have any bile going in through your system. So it should be, yet again, 12 to 18 inches long, like a ripe banana, and a medium brown. Now, my guess is that a lot of people aren't saying that that's what their poop looks like. They're like, definitely not that long, or definitely not that color, and it's not helping every, 15 to 18 hours. So where does it all go wrong? Where does it change? Let's take it all the way back to probably the most efficient transit times, which are that of babies and honestly dogs too. So anybody that's had a child or has a dog, what happens after they eat? They poop. That's kind of the natural progression, is they eat and then they poop. If you have a dog, you give them its morning breakfast, and then a couple of minutes later, you're going to have to go take them out for a walk so they can have a bowel movement. So what's happening here? Why is it that they eat and then they poop, and why is this so efficient? So you have these muscles inside your digestive tract called sphincters. So sphincters are meant to kind of close the tubing so there's no backflow. And you have multiple sphincters throughout your whole digestive tract. And a fun fact is that an activation of one sphincter is an activation of all the sphincters. So in your rectum, so you have your anus, that's your external sphincter that everybody knows. And then you have a part of your tube, that's your rectum. Remember I said that the full poop is the rectum and the sigmoid colon. There shouldn't be any fecal matter inside the tube of the rectum until your body's ready to have a bowel movement. So you actually have another sphincter that's a little bit above the rectum that we joke is kind of the knock on the door, the ring in the doorbell of, hey, are we in a good place to have a poop? Are we in a place we feel comfortable that it's okay? Okay, then that sphincter will open and then the fecal matter will enter in to the rectum, and you'll kind of feel that pressure of kind of bearing down that you need to have a bowel movement. So an activation of the sphincter that's at the esophagus going into the stomach, called your cardiac sphincter, as you're eating, because you don't want to have any backflow of that food, right? As the stomach is starting to churn and compress and move that food around to make it so that something that can be digested rather than that whole bite of steak that you didn't properly chew and just swallowed. You want to make sure that there's no backflow of that food. So that sphincter muscle from the esophagus to the stomach has to be firing. And that causes the rest of the sphincters to fire as well. And so that's what then will lead to about 20 minutes after having food and starting the digestion process, that internal sphincter right above the rectum will open up and the fecal matter will move down into it, and then you'll feel like you need to have a bowel movement. So that is why babies and dogs have the efficient that they eat and then they need to poop. So that's what you want to be. So babies are usually the most efficient. Now, there are some babies that deal with constipation issues, yes, but for the most part, babies are very efficient. So where does it start to go wrong? Well, potty training is the first part that it goes wrong, because as any parent knows, when they're out, potty training their child and they're out in the community, and all of a sudden that kid says, I need to go to the potty, the first thing a parent says is, hold it. No, we can't go here. The bathrooms are dirty here. We can't go. And so then the kid learns that pooping isn't a good thing. They need to try to hold it and kind of go against their natural urges that were there. And I get it. Bathrooms are dirty. It's something that they feel uncomfortable with. That's why we actually carry in our car a portable toilet seat that she can go potty in, so we don't have to worry about the germs inside of a bathroom. And especially with COVID, a lot of bathrooms were closed anyway, so it came in handy to have the little toilet seat with the bag in the back seat of our car. So as we're potty training them, they learn that they need to hold it. Then also, you might have them on a big potty and their feet are dangling. And that's not good either. It's actually most efficient if you have your knees higher than your hips. That's why squatty potties are very popular, because it helps to relax the pelvic floor muscles for you to be able to have a bowel movement more easily. So if their legs are dangling down, they can't relax their pelvic floor muscles. And also, they are terrified of falling into the toilet, especially the ones out in the community, because those toilet seats are huge. And then a lot of them are the automatic flushers that are just making loud noises. And kids are terrified. And I can understand why. If I was just learning how to be potty trained and all of a sudden there's like this vortex of water that's getting sucked down, I'd be terrified that I was going to fall in too. So kids are holding onto the sides of the toilet seats, which are dirty in its own right. Their legs are hanging down and then they're terrified they're going to fall down. Do you think that a kid could easily relax their pelvic floor to have a bowel movement if they're terrified they're going to fall into the toilet and get sucked away? Yeah, no, I wouldn't think so. So it kind of starts with that potty training mentality of you need to hold it. This area is dirty. You can only poop in certain places then. And also, too, when you do go into public, it's really terrifying. Now it happens when they're school age. Now, a lot of schools, which they're starting to change this, which I'm really happy about, but the bathrooms are in the classrooms, like they're in the back of the classrooms. And, kids are cruel and they're all laughing about toots and smells and things like that. And so do you think you want to go and be in that bathroom and have to have a bowel movement? And when you open the door, it's going to be a smell and all the kids are going to know and they're going to laugh, or maybe they hear you toot in the bathroom? Yeah, no, they're terrified of that. They don't want to be made fun of. And so a lot of kids, like in that kindergarten, they'll learn to hold it too because they don't want to be made fun of by their classmates. And then as they get a little bit older into elementary school, the problem also comes about that they don't really have any time to go to the bathroom except during recess. And what kid wants to go and have a poop while they could be outside having a grand old time with their friends running around? Because sadly enough, recess time is getting shorter and shorter in schools these days. So why would I want to spend half my time in the bathroom when I could be out having fun? So kids are just learning and getting trained more and more to hold it. You cannot let it go. You need to hold it in as much as you can. Then as they get even older, teenagers are so inactive these days. They're just sitting around. And so you need to be moving to be able to get your bowels to move too. It's really important that you have kind of gravity getting pushed down as you walk around, kind of going up and down on your bowels, and to help just stimulate the process and to get all the food flowing through. So inactivity is a huge part of why teenagers are also having issues with bowel movements. They're also starting to drink even less water as well. Like I've even noticed, kind of to track back, like with my daughter right now with COVID protocols, is they're not even allowed their own water bottles anymore. There's cups that they get filled. And my daughter drinks a ton of water, but she can't go and ask the teacher every single time to fill it up. It just kind of, she notices that it's a burden for the teacher, so she doesn't want to ask. And so her water intake is coming down. And I noticed that. And so her bowel movements are changing as well. So a lot of these kids aren't drinking enough water. Really, it's kind of a societal thing. We're not drinking enough water either. And that's going to be affecting it. Then as we get even older, medications start to come into play too. There's pain medications that will decrease the contractility of the intestines and it will cause constipation. So then our elderly population that are on a lot of pain meds, they're getting blocked up as well. So there's really it starts at a young age as to with this issue of constipation. And I think if you're a parent, you really need to make a conscious effort to not make poop be a bad thing. Maybe don't hold it everywhere. Like I said, my daughter says she has to go to the bathroom. I am finding a bathroom. And because I have one in the back of my car, then she can go whenever, because I never want her to think, hold it. And yes, if we have to go into a bathroom, public bathroom, and she touches the toilet seat, I have hand sanitizer ready to go because I don't want her to feel uncomfortable. I don't want her to feel like she can't touch anything, be afraid of falling into the toilet. So I think it's important that if you have young kids, you start working on this now and make them not so afraid of it, because it's going to set them up for better in life. So why is constipation a problem? Why is it such a big deal? And why should we be concerned about it? Well, it seems like, well, yeah, of course it seems like, you want to have your bowels moving, like it doesn't feel comfortable to be backed up. But let me give you a wonderful visual. So if you take all the food that you have eaten for an entire day and put it out on the sidewalk and it's 98.6 degrees, do you want that sitting out there for 3 days, which is considered normal? Like a bowel movement every 3 days by doctors is considered normal. They're not going to think that you're constipated. That rotting food, do you want that inside you? No. Ugh, that's disgusting, right? When you get that visual, it's just like, yeah, no, I want my transit time as fast as I possibly can, because guess what? Your intestines are still going to be pulling things out of the food that you eat, even as it's slowly making its way through. So what it's pulling out is just rotting food inside your intestines. I'm sorry if you have a squeamish stomach, no pun intended, but I really want you to understand that that's a bad thing. You really want it to be that you're that efficient, 15 to 18 hours in and out, because you're pulling out all the nutrients that you need to, but it's not rotting inside of you. So, and like I said, you don't know your so people that are having a bowel movement every 3 days, that doesn't mean that the food that they had 3 days ago is the food that's coming out. So it's probably even longer. That's why doing the BEAT test really gives you a good idea. So my patient said, literally, it's like 10 days. That's 10 days of that food just sitting out and rotting. No wonder then we're not as clear in our head, our bodies aren't functioning as well, because literally what we're pulling out of our system is just rotten food. And that's not the way you want to energize your body. That's not what you want to do to fuel your system to be able to function more efficiently. So that's why it's a problem, and that's why we need to fix it. Now I want to talk about a surprising demographic that I've been treating recently. And it's the really young kids, like the toddler ages, and not understanding the impact. Like there's one case where the digestive issues were actually causing a orthopedic issue, and another where it was just kind of causing them to be sick. So there was one patient of mine, they were a little over 2 years old, and they had one foot that was always turned in. The right foot was kind of pigeon-toed in, and they had appointments with the doctor and kind of asking, like, this foot, it doesn't seem to be turning out. The other one was kind of pigeon-toed, but then it came back out again. Like, why is this one side still a problem? And the doctor said, like, oh, let's get an eval with a physical therapist. And they did a session with someone over telehealth that said, oh, we need to put that kid in orthotics and get them special shoes. A 2-year-old, special shoes, because of the foot was turned in. Now, luckily, this patient, the mother was a patient of mine, and so they brought their child in, and it was an issue actually with an adhesion of the start of the large intestine, which is in the lower right quadrant. That was an area that was stuck, and the foot was then turning in because the pelvis was turned in there. Because that hierarchy of the organ systems, it's more important the digestive system isn't tugged on and compressed even more. So it actually caused the pelvis to turn in, and then thus the foot to turn in, to make it so that digestive tract still was as open as it could be with dealing with this adhesion that it had there. Now, I don't know why this patient had this adhesion there. It could have been a fall. It could have been that they were always that way. I don't know. But then the interesting thing is the patient's mother noted later that the bowel movements got significantly better after I did this mobilization. And that patient walked out of the room with their foot facing forward. There was no more internal rotation of their foot. Now, that's a huge impact on their life, because they were about to get put into orthotics and special shoes when that wasn't the cause of it. The cause of that turning into the foot was an issue in the pelvis and the digestive tract. Now, if that patient had been told to stay in those shoes, they could have had a real issue later on in life, because now you're externally fixating a foot in a leg to try to correct from a problem up higher. that's just going to lead to issues up that kinetic chain and up through the body. It's not going to be good. So I'm very happy that before they got into orthotics, I was able to mobilize the abdomen, and I taught the mother how to do it as well, because you can just do soft mobilizations at home to keep everything going. So they no longer had constipation issues. And then also they didn't have to wear the footwear that would cause issues down the road. I had another patient who the mother was my patient, and they said, can you help with withholding issues? Their child, who was about to turn 3, was having issues where they wouldn't relax and let their bowels go. So they wouldn't have a bowel movement for a couple days. And it got to the point where the pediatrician prescribed Miralax at first and then milk of magnesia. And actually, the child started to lose a lot of weight because they were sick to their stomach from the milk of magnesia. And I remember my patient saying that she actually tried to take the milk of magnesia just to understand how her child was feeling. And she said that she felt sick the whole day and didn't want to eat. So she could understand why her child didn't want to have any food, because the milk of magnesia was making them really sick. And then they wouldn't have a bowel movement to begin with. And it got to the point where the pediatrician then said, I don't know what to do, so why don't we have them see a pelvic floor therapist? Now, I said, before you take your child to the pelvic floor therapist, why don't we try treating them in the kind of style of mobilizing the organs and see what's going on? So for this patient, the biggest thing was actually a dysfunction of the tailbone. The tailbone was really bent forward and was rotated. So that's going to affect the ability for the pelvic floor muscles to relax and be able to have a bowel movement, because all those pelvic floor muscles are attaching onto the tailbone. So I was able to treat the tailbone all externally while they were sitting on their mom's lap and watching a video on the phone, because they didn't really like me being down there and causing pain. So we needed to do some sort of distraction. And then just mobilizing the abdomen, just finding little areas of tension through the intestines and freeing those up. Now the patient is fully off the milk of magnesia and the Miralax and is having regular bowel movements without having this kind of fear of letting go, and able to just relax and have a normal bowel movement. So this child that was losing weight because they were so sick from having these drugs to try to help them go was fixed by just mobilizing the organs. So it's like, kind of rather than just throwing medications at it, let's think about something else. Let's figure out what that root cause is and go after that. I also had another patient who was a little bit older. They were 8 years old, and they were also on Miralax every day to have a bowel movement. An 8-year-old. I don't know why we're putting these kids on all these different medications so early on. And it yet again took one session of, I treated the tailbone very quickly, and there was just some restrictions lower down in the abdomen that I had to clear up. And then they were fully off Miralax. They have been fully off Miralax for 6 weeks now, having a bowel movement every day, not forcing it, being exactly how it should be. So this is a population that I have been shocked of how much I've had to treat recently. I treat a lot of adults for bowel movement issues, for constipation, but it's not as often that I see so many kids. And it's just in a row, I've been seeing all these young kids that are having issues with constipation. And what's being thrown at them are these other ideas of these external devices to help the foot, or these drugs to help them go, which really just end up making them feel sicker. And it's not helping the root cause of the problem. So let's start to open our minds, as I always say on here, let's think bigger as to what could be the way to fix this. So let's go to that now. What can we do about constipation? So the first thing you're going to hear me say is tailbone, mobilization of the coccyx, because of the 27 different fascial connections onto the tailbone, which it's not just the pelvic floor muscles, it's also all the fascia, that connective tissue going around all your digestive organs. They are attaching onto the tailbone as well. So you want to have that tailbone in a nice neutral position to allow for improved bowel movements. So the first place I treat with anybody that has constipation issues is their tailbone. After the tailbone, then you can go around and just improve the mobility of the fascia around the digestive organs. I'm not going within the organs themselves. I'm not mobilizing specifically inside the bladder. I'm dealing with all the fascia around it that's inhibiting it from being able to do its job. So it needs to contract to move the food along. Now, if the walls of the intestines need to kind of pull together to contract, but they're held back from the outside of these adhesions that have been formed, they're not going to be able to officially do their job. They're not able to really move the food along. And that's the biggest issue that I see. So you want to be able to move the food along by clearing up the fascia around the organs. So you can do that with a therapist going in and mobilizing the organs. I also have on my Instagram doing the pelvic clock mobility and mobilizing the organs as well. Just kind of going in and feeling for what feels tight as you try to move your pelvis around in the position of a clock, and then kind of going into your abdomen with your hands and finding an area that feels stiff or is painful, and then holding on to that as you go in and out of the diagonal of the pelvic clock that's bothering you. So you can do your own self-mobilization. It doesn't have to just be a PT that's doing it. And the other component that everyone forgets about is the diaphragm. You need to have good diaphragmatic mobility to be able to massage your organs and keep them moving so the adhesions aren't formed. In the most efficient state, the diaphragm can actually move the kidneys up and down about an inch. So you really need to have good diaphragmatic breathing and have the ability for your diaphragm to contract and go down to kind of do this massaging motion through your intestines to keep everything moving as well. So don't forget about your diaphragmatic breathing. That is just as important as the tailbone and the mobilization of the fascia around the diaphragm. I hope from today's episode that you understand that poop's not such a dirty word, and it's really important to understand the transit time and how it moves through your body in terms of your overall health. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.